In this video, we're going to be talking about common side effects with medications, as well as discussions around safety. In general, the big picture is that the main medications that we use for OCD, the SSRIs especially, have been around for quite a while now, multiple decades, and have been widely used. So we have lots of really good safety information that show that in general, these are really safe medications to use. Also, the side effects are generally reversible. So while we'll go through the specifics, it's important to recognize that our goal is to have you without side effects or with side effects that don't really bother you very much. And that if for some reason you do have side effects, we can always just make a change and get rid of them. What are the side effects for medications in OCD? It's important when considering OCD medications and their side effects to break them into two groups. The first are medication side effects that happen at first when you start taking the medication and maybe that resurface when you're increasing the dose, but go away. The second group are for medication side effects that show up a little bit later on, maybe when the medication starts working, and usually reduce but don't always go away, at least until you stop the medication if you choose to. In terms of those initial medication side effects, that includes things like some belly stuff like nausea or loose stools, for some people even diarrhea. Usually only lasts a couple of days, maybe up to a week or two. And that's because our gut is full of serotonin receptors because it comes from the same part of the embryo as the brain when we develop. Our body adjusts though, so again, those go away. Other common initial side effects include dizziness, headache. Some people have a temporary spike in anxiety or even kind of panic symptoms if you've had those before. That all goes away as well, and we can help reduce the risk of all of these side effects by starting with really low doses and moving slowly. In terms of that second category of medication side effects, the ones that kind of show up a little bit later on, that can include things like weight gain, which does happen for some people, though not everyone, and is usually about 5 pounds or so. But again, it's person dependent. And so that is something that we need to track when you're starting a medication is your weight and just making sure that's not an issue. Other side effects that can show up really commonly, unfortunately, if we get to higher doses, people will have some sexual side effects, which can include a decrease in libido and difficulty achieving orgasm. When we have those side effects, that's no good, and so we will typically reduce the dose or switch to a different medication so you don't have to deal with that. But it's person dependent. Other common side effects include fatigue or kind of sleepiness in the afternoon especially. Also, some people will have sweating at night, jaw clenching, or more vivid dreams than usual. Almost no one gets all of these things. What we see is that certain medications are more likely to cause side effects or certain side effects than others. For example, Zoloft tends to cause people to sweat at night, whereas that's less likely with Prozac, though it can still happen. Am I likely to get side effects? So the bad news is that people with OCD and anxiety-related disorders are more likely to experience side effects, although that's typically the side effects that we see when you first start or make adjustments in the medications. So things like the belly upset, a temporary increase in anxiety, dizziness, headache, those sorts of things. We can help reduce that risk by helping it feel more and more like it's your decision, which is very important, and by using lower doses and going at a pace that is at your pace. Essentially, the more you feel that you're in the driver's seat, the less likely you are to experience side effects, because our body's really good when we're anxious at tuning into signals throughout our body and turning up the volume. Sort of like when you hear a clock ticking, if you didn't hear it before, now it's the only thing you can hear in the room because our body really starts listening to that and kind of won't turn it back down again. So with anxiety, the more anxious we are going into the medication, the more likely we are to turn up those neural signals and experience those side effects. And by going with low doses and making sure that you're going at a pace that feels okay to you, we reduce all of that. Are side effects permanent? In general, side effects are not permanent from the medications. All of the side effects that happen when you first start a medication or going up on a dose will generally go away. The only side effects that are kind of longer term sometimes that can stick around are weight gain, not because you keep gaining weight, but just if you do put on a few pounds on the medication and then you stop the medication, those pounds don't just fall off for most people, though for some people they do. Others, you do kind of have to go then and do the work to lose those few pounds, which is unfortunate, and another reason why we want to monitor weight to prevent this. Certain medications are less likely to cause that weight gain than others as well, which is another thing to talk about with your provider. Some studies have shown that some of the lower libido issues that can come along with being on SSRIs long-term can stick around when you stop taking the medication, though other studies seem to indicate that more has to do with the fact that those people have aged a number of years during the time that they've been on the medication. Everything else, you stop the medication, the side effects go away. They're not permanent. Can we reduce the risk of side effects, and how? As we talked about earlier, it's very possible to reduce the risk of side effects, particularly the ones that show up at first, by going more slow and starting a low dose. To be more specific about that, one of the ways we do this in OCD clinics as a specialist is we start with liquid versions of the medications if you're worried about or feel you're predisposed to side effects. This allows us to use ultra low dose to get things started. For example, with a medication like fluoxetine, also known as Prozac, we would normally start at 20 milligrams. We could start with a 10 milligram pill, but to be extra cautious, we can start with liquid, have you take a single drop, and have that be 0.01 milligrams, which isn't enough to actually kick off anything in your system, but can help you get through the initial nerves and then go up at a really gradual pace, but changing as much as every day if you want to, and still get to a target dose quickly enough to really help you out. This greatly reduces the risk of side effects and can help for people who have been worried about starting medications for many years suddenly feel like, oh, why did I even wait so long? Also, if you've ever had a bad experience starting an SSRI in the past where you did feel panicky or felt something bad at first, this can really help to eliminate those experiences. Will medications impact fertility, pregnancy, or breastfeeding? When it comes to fertility, pregnancy, and breastfeeding, many women's mental health experts have studied this over time and found time and time again that people who take an SSRI do better and their children have better outcomes than people who choose not to take an SSRI. So while it's understandable to worry about medications when you're pregnant or when you're breastfeeding, we've seen that people who actually benefit from the medications have a better outcome than if you were to continue to be depressed or anxious or OCD, as best we can tell. It's still a personal decision, and there's some great resources out there for you to be able to review and decide for yourself. There are certain psychiatric medications that are not safe or pose more significant risk in pregnancy. This does not typically include the SSRI medications we use most commonly in OCD. Is it safe to take medications long-term, or are they toxic over time? The great thing about SSRIs is that they've been around for several decades now and used by many, many individuals, which means we have really good safety data out there that's been published, reviewed, and many anecdotes from folks. This means that over decades of use, people are still doing well and not having major safety issues. These medications are generally considered to be safe, non-toxic, and people have better health outcomes to their physical health when they take these medications than when they don't, if they have an underlying depression or similar illness. Most likely the case for OCD as well.